need to just release my neck. Just take it off.
Yeah, let's do it.
Okay.
Go ahead and lift the head up. That motion there, that feels okay?
Yeah. Oh my God.
Life changed?
I think so.
Where'd you feel that?
It was like it shot straight up my, like, the back of my neck. Yeah, it feels like you just, like, pulled that part of my spine, the top.
Yay.
Yeah.
We're here with Keira Croft. She has never been adjusted before. I'm excited.
Yes.
Cool. Awesome. Is there anything that's bothering you today that we can look into?
Everything.
All the things?
Mostly my back. I
Okay.
carry a lot of, like, stress in my back and my neck.
So is that, when you say back, is that like mid-back?
Good question. It is, like, my upper and mid-back,
Okay.
mostly, and, like, my trap shoulder area, too.
Okay.
Yeah.
And do you feel that just sitting here right now, or is that something with certain movements that gets activated?
I definitely feel, like, compressed when I sit. I'm like, oh, my back just feels like it wants to stretch.
Cool. So a lot of the things we'll do today is going to create some decompression. Can I actually pull up on the head right now?
Yes, please.
So me just doing that.
Oh.
Okay.
Sorry.
No, that's okay. And then do you ever get stuff going down the arms, fingertips, anything like that? Like numbness, tingling?
Not that I know of.
Okay. So it just
feel.
kind of feels like muscle tightness,
Yes.
soreness. When I push in through there, is that kind of what we're talking about?
Yeah.
What about in the front here? Not as
Not
much?
as much.
And then shoulders feel pretty good. And then as we come down, okay.
Yeah, that's bad.
Cool. Okay, so we'll definitely work some soft tissue in through there. We'll get some adjustments. So a lot of the adjustments we're working to basically create, and allow this motion to happen. And then a lot of the exercises and movements we promote afterwards is there to kind of lock that
Cool.
in. So let's get into it. I'm going to have
Yes.
you go onto your back whenever you're ready.
Okay.
So your head will go up here looking up at the sky. So other way.
Oh.
It's hilarious.
Like, let's do the back first.
Yeah, no, it's hilarious. How...
we all just want to, like, show off
It's
the
a
butt.
50-50 It's 50-50 chance. So kind of tight through here as well.
Oh, yeah.
Okay. And you can get like both of us too at certain points. Hey. Do you get headaches at all?
All the time.
All the time. Is when I kind of press in through there, does that recreate any type of headache?
Sort of, yeah, in my, like...
Kind of behind the eyeballs?
Yes.
Yeah. So this is a little trigger point spot. You're super tight.
Oh, yeah, it feels like a rock in my head.
Sorry.
No, it's okay. It has to happen.
Yeah, I want to warm up just a little bit before we get into those adjustments. And I'll kind of talk you through that stuff.
Please.
Are adjustments scary at all?
Yeah, I feel like watching them just scares me.
Yeah.
Yeah.
I think the videos are a little scarier because
Yeah.
when the microphone's like right there, so it is really loud, but
Yeah.
that sound is basically like, do you ever crack your knuckles?
Yes, I do it all the time.
Okay, so same thing. It's just your spine knuckles. So we have these synovial. Sorry, is that too much?
No, it's perfect.
Okay,
It just feels like, oh.
That's what needs to happen. So yeah, we have any of our synovial joints is a bone connected by some fibrous tissue, and in that tissue there is synovial joint fluid, and that's what helps the joints glide together. And so that popping sound is when we release that or create a gap or decrease in pressure. Those gases are coming out of solution. Oh, you're super tight here.
Everywhere.
And then are you going back to San Diego?
I am. Yeah, I gotta drive after this, so sitting for another 3 hours.
So you planned this out perfectly.
Yeah. I did, obviously. I mean, I have time to rest, for sure. Oh.
Sorry.
No, it has to happen.
So we're actually going to start on this right side. Do you feel like that right side's a little bit tighter?
Yes, my whole right body.
Okay. So that joint kind of locks out right here.
I'm
going to do a little push past that.
Oh my God. Whoa. Sorry.
No,
Scared the crap out of me.
That felt pretty good though?
Oh yeah, wow. I can hear again.
The next sinuses released.
Yeah.
That's actually how chiropractic was kind of started, was this guy who was deaf. and I don't know how true this is, but D.D. Palmer, like the founder of chiropractic, apparently they said that he adjusted him and he could hear again, but I think the real story in like the books is that he like hit this. It was a janitor, and he like is back in the day when they would like hit people. He hit him on the head with
cartoon with a pan or something.
He was yelling at him, but the dude couldn't hear, and so he hit him with a book, and the book like hit him in the head, and apparently he could like hear again. So
ooh, that's fascinating.
So, yeah, same deal
history
here.
lesson.
Okay, little push.
Ooh.
Camera in the face. Perfect. And then if you want to come in at this angle. All right, how are we doing so far?
Amazing, I think.
Yeah. Head is still on.
Yes, head's still on. I love it.
All right, I'm gonna have you bring your chin down towards your chest. Let all the air out. Kind of take the breath away.
Yeah. Thank you.
Yeah, of course. So we're gonna come down just a little bit lower. So big tuck, let all the air out again. Cool. Let's go through. I know the camera's in your face. You're like, what do I do?
What do I do? It feels good.
So we're gonna go through all the joints. Sometimes they're long, sometimes they're not.
Yeah, my joints are weird, I guess.
Very good.
Ooh.
We could make it pop. You just wouldn't like me if I did after.
Yeah.
So I kind of go with the natural motion. Let me take this guy. All right. So come in close.
Oh.
She's gonna be taller.
Yeah. Oh yes, I heard that.
Good. This tattoo looks super fresh.
Thanks. I got for my birthday.
My birthday. Is that new?
Yeah.
Sweet.
It's fresh.
All right. Cool. So, have you seen this guy?
I have.
How do you feel about it?
I think it would change my life because I need to just release my neck. Just take it off.
Yeah, let's do it.
Okay.
Go ahead and lift the head up. That was the best pre-strap answer. I think it's gonna change my life. I actually had this done about 2 days ago.
Oh yeah.
My life has changed.
Oh.
So that motion there, that feels okay?
Yeah.
Well, I'm gonna do a little pull at the end.
Oh my god.
Life changed?
I think so.
Where do you feel that?
It was like it shot straight up my the back of my neck.
Yeah.
Yeah.
Did that go down a little bit?
Yeah.
Like upper back, perfect.
Yeah, it feels like you just pulled that part of my spine, the top.
Yay.
Yeah.
Let's go ahead and come onto your side. So you can put your head right here and then face me.
Thank you.
Yeah, 360.
360. Okay.
Perfect. I'm gonna bend this leg here. I'm gonna scoot you towards this way.
Okay.
All right. So we're gonna get into the lower back. I know that wasn't as big of an issue.
Yes. Still is. All of it is.
I've been using this towel and I feel genius for it for the squeaky shoes.
Oh, if you want, I can take off my shoes.
No, they're perfect.
Okay.
All right, go ahead and look over this shoulder here. Good. We're gonna do a push right there.
Ooh. Ooh. That felt nice.
Go ahead and flip on over. Yeah, the squeaky shoes at my office, my normal office, not this living room. One of our tables is really squeaky, and so I had to switch it out because I'd have to like whenever I stepped on the table, like to do the neck crack one, it would squeak and then take away from the whole point of the crack.
Yeah, you gotta hear the crowd. Cracks are important.
Go ahead and look. Yeah, perfect. Good.
I sound like a water bottle.
Yeah, that was a big one. It was like a thump.
Yeah.
And go ahead and come on up this way. And swing the legs to the left. Yeah. Did you want to do some needles today? We don't have to. I know this is your first adjustment, so that's a lot. I'd say, yeah, let's just do a little bit of soft tissue through here.
Yeah, I think I would love to come back for more if I mean, I'm sure I'll love this.
Yeah, we don't need to throw 100 things at you. So bring the chin down towards your chest, over to the left, and then can you pull this arm across? So if you grab that one, good.
Ooh.
Yeah, big breaths through there. I worked with this chiropractor down in New Mexico, and he's known for like having really mean thumbs and doing like we could go harder if we wanted.
Oh, I bet.
I don't want you to cry on camera.
Yeah. I'm sure someone would like that, but I don't want to.
But yeah, it was like the dentist asking you a question and then like putting their fingers in your mouth.
Yeah.
Like, and you have to like think about what you're gonna say. So he would like ask me a question and then start like digging his thumbs in. I'm like, bro, I cannot think right now.
I can't breathe right now.
His name is Dr. Bo Hightower. He's a big YouTuber.
Oh, that's
He does like the hammer and the chisel. Have you seen that guy?
Oh, I think so, actually.
Go ahead and pull that through. Yeah, he's super
It's intense.
intelligent. Yeah, I had him do it on me. It's actually pretty nice. It makes sense. He looks at things with posture and anatomy, and I'm more range of motion and feels. That's why I don't do x-rays on everybody unless it's like a car accident case. How are we doing?
Great. I mean, it's not awesome, but I know it's gonna be awesome. That's the whole point.
So tell us about your tattoo.
Well, I am a fan of some horror movies, and this comes from one called Midsommar.
Okay.
And it's basically a bear on fire. So a bear gets set on fire in the movie, but I won't tell you more. So you just gotta watch it yourself.
It's good not ruining it. So I'm gonna do just a little bit of scraping with some CBD. Is that okay?
Yeah, sure. Cool. I love CBD.
Sweet. I'll get you a bottle before you leave. Remind me.
Sweet.
Can you bring this right arm behind you right here? Yeah.
Like
perfect.
that?
Yep. Awesome. So we're gonna get kind of right behind that shoulder blade. Ooh. You can rest it down if you want.
Rest it.
Yeah, that's perfect.
I'm constantly flexing.
Stop flexing.
Stop
be
flexing.
A noodle.
Yeah, I know. I gotta be loosey goosey. I actually have a question. Do you know much about is it fascia? Fascia tissue massaging?
So that's kind of what we're doing right now.
Oh, okay.
Yeah, so everything that I look at, so more old school thought is like a specific muscle is what's wrong.
Yeah.
Now we look at things as like fascial trains. So like we can actually, if you have tension up here, we can actually rub the bottom of your feet, and that fascial line goes all the way up through the posterior chain.
Yeah.
So this is kind of similar. Sorry, I'm leaving you a little bruise right there. Is that okay? Okay.
Oh yeah. I mean, I can't see it. I don't care.
Yeah, kind of everything that we're doing is like fascial release. So that like pin and stretch that I was doing. But we have the skin, the fascial tissues sit underneath the skin, and then the muscles are below that. So I like to think of fascia as like the plasti wrap. Or
like cling wrap.
Yeah, exactly, around your muscles.
That's cool.
Because they all your muscles engage and connect together. Like it's not like when you move your shoulder, it's just your supraspinatus pulling it up.
Right.
It's your delts, it's your traps, it's your rhomboids. Everything's kind of connected as one. And so instead of being like, this is the problem, let's put a needle right here, I like to just look at the whole chain and be like, let's just hit this whole area. So I have more of like a physical therapy school of thought. Okay, yeah. Which is more broad versus like traditional chiropractic is like this exact joint and bone is what's wrong, and we're gonna adjust just that one, and then you're gonna be good to go. That'll be healed. Yeah, I'm more of like and people won't like this in my profession, but I'm more of like a carpet bomber. So I just all right, we're hurting here, let's blow it all up. Do all of it. Just blow it all up. Because that's how I feel when if I go in and I have something just specific done, I'm like, yeah, but can you could you do everything else? Yeah. That's what I'm saying, just do my whole back or whatever else. I do have very tight hips as well. Okay. Yeah,
just got tight.
Cool. Yeah.
Tight everything.
You can relax that arm.
Cool.
Yeah, we can actually get into the hips. Is that on both sides, or is it just your famous right side?
It's mostly my right side. Yeah, my right side's pretty fucked up.
So we'll do a little assessment in a second. We'll just quickly go through this. Mm-hmm. Did I answer your question about fascia?
Yes, you did. Yeah. I follow some people who make videos that explain it. So I was just curious.
Yeah.
You know, like people can just do it themselves, like twisting your earlobes and stuff.
Yeah.
And, yeah.
Like the lymphatic system is super. Is that yeah? That's
another part of the interest I have in that.
Yeah, there's I'll send you some accounts to follow. I really like this guy, Stop Chasing Pain. He's out in New Jersey, and he does just a lot of interesting like thoughts. That's like, why isn't this taught in school?
Yeah.
But makes sense. And then you realize like you have a lot of power yourself. You don't have to go and see somebody to feel better. Right. Let's go onto your stomach. But sometimes it's nice to have that jump start, you know, to open up that new range of motion. And you can look over to the right. Yeah. Don't mind the sparkles on there. That's Exotica.
Girls right here.
Yeah. So you're good right there. Okay. Perfect. So you actually do have some rotation here. Do you see how the right heel gets to the butt?
Yeah.
And the left one is like
it's a little more.
Yeah. So that shows us kind of a rotational pattern. When I push in through there on the left, is that a little bit more tender than the right?
Yes.
So this area might just be a little bit of a compensation pattern. So you're feeling more of the pain on the right because it's getting used more versus the left is at the actual like stuck spot.
I lean a lot on that side too.
Yep, that makes sense. Mm-hmm. So I'm gonna see if we can even that up a little bit. You doing okay with the pressure?
Yeah.
Okay.
I do like when I get massages and they walk on my back and they just beat me up.
I always, I shouldn't say this, but because I get adjusted like once a week because I work with a chiropractor, but I also in between have my girlfriend just step on my back.
Oh yeah, it feels awesome. I jump all over my husband's back. It's great. He's the jungle gym for me.
Sometimes that's what you need. It's just
to get beat up.
Yeah. Yeah, she like knows it's her job. I'll come in and just lay on the floor and she just
jumps on.
How was your day at work today?
Steps on your neck.
Yeah. She's got it figured out. Yeah. Do you mind if I press on the side of the hip here?
Yes, you may.
All right, perfect.
Woo.
A little spicy in there.
Yeah, it's a little ticklish.
So I know I got the right side, but all I'm doing is working on the left. We'll kind of see how you feel walking out of here.
So how that was it should have been internal.
No, it's great. Man, during COVID we had you know, I read a lot of people's facial expressions when we do soft tissue to see like, you know, how we're doing.
Yeah.
But during COVID we had to wear the masks. And so I had to rely on me asking people like, is this okay? Like 1,000 times.
Yeah, your eyes can't always.
But I always like very verbal people because I can kind of feel what you're feeling, you know?
Yeah. I know.
Because some of the stuff we do is intense, but it doesn't need to be crazy intense.
Right.
So, real quick, do you see the difference there?
Oh my god.
Left heel to butt.
What? How did you do that?
So, I know. You can do all that stuff on your own. I'll kind of show you, but go ahead and come on up.
Okay.
And, yeah. How are we feeling?
Oh my god, thank you. So far, this is amazing.
Is that a little bit more open? Left to right, up and down? All the way around?
Very loosey-goosey now.
Okay. Well, let's keep it with that.
Cool.
All done. Yay.
Yay. Bye. Thank you.
Sweet. Thank you. Thank you so much for filming. Yeah, I wish you were my full-time person because you're getting like all the angles in my face.
Yeah, you were really